Heart failure occurs when the heart muscle weakens and struggles to pump enough blood for oxygen. And unlike heart attack, heart failure happens gradually. In some cases, a heart attack can trigger heart failure as it weakens the heart muscle. Alternatively, heart failure can also develop as a result of coronary heart disease and other chronic diseases. Yet, while having a diagnosis can help you watch out for heart failure, it is possible to develop heart failure, and even when you think you're in good health. In fact, your body gives you signs early on to alert you of heart failure. Unfortunately, we often look at signs by themselves, which may make heart failure obvious. However, when several symptoms are adding up, it is a good time to check up on your heart's health. But what are the signs you need to look out for? Don't go anywhere and keep watching. In this video, we'll share 5 of the early signs and symptoms of heart failure you should not ignore. Some might even shock you. But before we get started, can you do us a favor and like this video? And make sure to ring the bell for future notifications. And please consider subscribing to Heart Disease Code for more help managing your blood health. And stick around to find how you can get 2 free gifts. Let's begin the countdown of the 5 early signs and symptoms of heart failure that you should never ignore. Fluid buildup. When you're experiencing an excess of fluid buildup, it may be a sign of heart failure. Fluid buildup in the feet, ankles, legs, and abdomen. The reason for the buildup of fluid is the heart no longer has the capacity to pump strong enough to bring the fluids back up. That's why it pools in limbs and is often most notable in the lower legs and feet. This is called edema. It can also occur in the abdomen. This can become dangerous when the fluid starts to build up around the lungs, causing excess coughing and sneezing of white-pink mucus. This white-pink mucus is one of the hallmarks of chronic heart failure, or CHF. It is easy to assume that a swollen body part is the result of water retention, but when paired with other symptoms, it is a clear indication that your heart is struggling. Research highlighted that fluid retention and rapid weight gain are a strong precursor for heart failure, with a high amount of hospitalization. So, how can you know if fluid buildup is a sign of heart failure? Harvard experts point out that if you experience this symptom, you should record your weight daily to observe for rapid and significant change. Gaining more than 2 to 4 pounds in a week means that your heart is likely struggling. Another symptom of heart failure is number 4, shortness of breath. Shortness of breath, also known as dyspnea, can make it difficult for you to both be active and sleep. It is also considered an important sign of heart failure that you should not ignore. If a small activity like walking up a flight of stairs gets you very breathless, it's time to talk to your doctor. It can get worse too, as some people may start feeling breathless even when they're at rest. It can also affect sleep, especially if lying down makes you feel like you can't get enough air into your lungs. Some patients even say that it makes them feel like they are drowning when they are flat on their back. Shortness of breath occurs when blood backs up in the pulmonary veins and fluid leaks into the lungs. The pulmonary veins' role is to transfer blood between the heart and the lungs. A review of 63 studies observed strong links between dyspnea and heart failure. They found that dyspnea is a common cause of hospitalization for people with acute heart failure, and over 70% of patients with acute heart failure experience this symptom. A study of 464 patients also noted that psychological factors and somatic symptoms, including depression and anxiety, are commonly linked with the diagnosis of dyspnea and heart failure. In short, if you're experiencing a cluster of both shortness of breath and mental restlessness, it is important to speak with a medical expert and check on your heart's health. Next on our list is number 3, lack of appetite and nausea. A feeling of being without appetite or nauseous can indicate heart failure. This is because when the heart pumps less blood, the digestive system receives less of it, which can impact its function. And while this can translate into loss of appetite and nausea right away, you might also experience it at first, abdominal pain and tenderness. A study rated the digestive functions of 186 patients diagnosed with heart failure. They found that 38% of patients had reported loss of appetite, along with symptoms of depression and poor sleep. The lack of appetite may also be a psychological effect associated with the other symptoms already mentioned. So while loss of appetite and nausea can be the cause of many things, if it is paired with one of the symptoms we've seen so far, it could mean that your heart is struggling and could lead to failure. And there are 2 other signs and symptoms you might want to watch out for along with loss of appetite. But before you find out what it is, are you ready for 2 free gifts? Find out everything you need to know to prevent heart disease with our free ebook, The Surprising Truth About Fat and Cholesterol. Plus, get exclusive insights from some of the world's leading medical and nutritional professionals by watching the first episode of The Untold Story of Heart Disease. Both gifts can be grabbed simply by clicking the link in the description below, so go and claim them for free. And now, let's go back to our list of signs and symptoms of heart failure, with number 2, prolonged fatigue and confusion. Fatigue and dizziness may be the result of many things. However, when paired with other symptoms, it can also be an early sign of heart failure. Feeling tired all the time and having difficulties doing everyday activities such as shopping, climbing stairs, carrying bags, and even walking can indicate the heart isn't pumping hard enough to meet the needs of the body's tissues. Because of this, the body diverts blood away from the less vital organs in order to make up for the lack caused by the heart failing. A study noted that 50.4% of men and 51.2% of women with heart failure experienced high levels of fatigue. They also observed that maximal workload, physical health, emotional health, and depression were common signs linked to fatigue. So don't dismiss your fatigue, as it can be a sign that your heart is failing. If you are suddenly feeling more tired than usual, or if you feel like you are always tired, even if you hardly do anything and get enough sleep, consider that a warning sign. Number 1 on our list of the early signs and symptoms of heart failure is heart palpitations. Heart palpitations are a feeling of having a fast or fluttering heartbeat that you can actually feel in your chest. It is not usually painful and may also feel like your heart is skipping a beat. It might feel like you're having a panic attack. However, it can also be a sign that your heart is failing. This is because, to make up for the loss of pumping activity, the heart has to beat faster. If the heart remains in a state where it has to work for longer periods of time, it can also mess with its rhythm, thus causing skipped beats or an irregular heart rate. Lengthy research noted that heart palpitation plays an important role when diagnosing and determining the severity of heart failure. Palpitations can occur on their own and will not be a worry, but if they are paired with the other symptoms discussed, then you will need to talk to your doctor about it. Overall, while these symptoms may indicate something other than heart failure, experiencing one or more could also be a sign that your heart is struggling. So if you're unsure, don't wait out and speak with a doctor. And now, we want to hear from you. Have you experienced one of those early signs or symptoms of heart failure? Share your experience with the Heart Disease Code community. It might be helpful to someone else. And before you leave, make sure to claim your free gifts by clicking the link in the description below. And don't forget to subscribe to our Heart Disease Code channel and hit that bell button for more help managing your blood health. We want to keep making more informative research-based videos for you. So if you got value from this video and would like more of it, you can send us a super thanks by clicking the thanks button at the bottom of the video. Thanks for watching and have a heart-healthy day.